delivered many lectures in many ISACON conferences. I also request Dr. Jitendra Data sir to take the stage. He is a senior consultant anesthesiologist from Data Clinic, Sitamarhi. Next, I request Dr. Vinod Kumar Kashyap sir, ex-HOD Department of Anaesthesiology, Patna Medical College Hospital, and present Professor and HOD Department of Anaesthesiology from Himalaya Medical College, Paliganj, Patna. Next, Ashram Hospital, Patna. In 2005 to 2011, he has also been past Vice President of Bihar Jharkhand Society of Anaesthesiologists, Bihar Jharkhand Society of Anaesthesiologists, 2022 to 2023. He is presently President of Teacher Association, NMCH Patna. His public
presenting cases in various ISACON and even national level. Do watch my videos live, which are available on YouTube. Today we have assembled here to discuss about ambulatory anesthesia. That's a very interesting topic. Let me speak just briefly. Incidentally, there have been supposed to be 3 speakers. We have only 1 speaker with us. So I'll speak little extra about what it's all about. We have got so much of extra time. So daycare surgery and anesthesia for pediatric patients require careful, child-centered approach to ensure safety and comfort, as you all know. And actually the speaker should have been Dr. Indu Sen. She is incidentally absent. And regarding the next topic would have been managing resistance PONV during ambulatory anesthesia daycare surgery. As you all know, managing resistance PONV effectively requires proactive approach. Proactive, combining risk assessment, preventive strategies, and appropriate treatment intervention. The speaker would have been Dr. Samina Khandi, but incidentally again she has some excuse, some reason she is absent. There is one speaker only present, that is the third topic for this session, ambulatory anesthesia, that is neuraxial blocks in daycare surgery. Now, as you are aware, neuraxial blocks are valuable tool in the arsenal techniques available for the ambulatory surgery. It's one of the important tools in the arsenal of ambulatory surgery. Their ability to provide excellent analgesia while minimizing the reliance on systemic opioids. That makes it ideal neuraxial block for daycare surgery. And the only speaker which is available, that is Dr. Vanita Ahuja. Let's learn more about it from Dr. Vanita Ahuja. May I request Dr. Vanita Ahuja to be here? Instead of 15 minutes, we go on speaking.
This is the first time that we are giving unlimited time to you.
The one thing, it should be on record. The kind of conference which is presented here in Samrat Ashok Vigyan Hall is amazing. The one innovative thing which they have added in this ISACON Patna is Mento quiz. Menti quiz. That's absolutely thrilling. I'm sure every next conference will have Menti quiz. And this is the first time ever they have included. And yesterday you have seen the cultural program. Amazing. That group for Kolkata which has come. I don't know how many people have watched it. Unbelievably good. Unbelievably good. Do watch it on your videos. They have taken it. And ma'am, please take your take time. Talk about your neuraxial blocks for ambulatory surgery and update.
A very good morning, respected chairpersons, colleagues, and dear friends. You know, we have also seen it in the literature that there's not much difference, but yes, sensory effect is better. You will get less motor with your Pibaki and your
Firstly, amazing presentation, and I'm sure this has been recorded, and the longest presentation
Definitely.
in this conference. Everybody should preserve it and watch it. Those who are not coming, for the initial part of the lecture. Ma'am, in a lighter vein, if I ask you, I'll ask you only two questions. First question is on a lighter vein. Let's see what is your presence of mind. There's supposed to be 3 lady speakers today and 2 backed off, and you were the only present person. What could be the reason? Why did they back off?
No.
In a lighter vein, answer.
I understand.
Think laterally.
Yeah.
Out of the box.
No, it is not that they have backed out. Probably they have a better, they are requiring more at a place which they are currently right now. That is, I would take it, because you are a multi-phase, I mean, we have so many responsibilities and they may be at the right place. Probably I could reach here because my rest of my things were settled at home. So that's why I reached here.
Let me answer to you. The correct answer would have been, since all the speakers were ladies and your name is Vanita. So you are representing Vanita. No need of other ladies.
Oh my God.
Vanita Ahuja. That's the right answer.
Okay, thank you.
Okay, lock कर दिया.
Do you think that levobucovacaine against bucovacaine and levobucovacaine is much better than bucovacaine?
Well, that's what I said now. The duration would be slightly lesser than bupivacaine, and sensory would be also, motor effect would be lower than bupivacaine. So if you want to use it, you want a short.
Difference between both.
No, but if you use it clinically, the regression would be earlier in a levobupivacaine patient. Then it depends. See, duration and condition are 2 different things. If you have a cardiac patient, but you want a dense motor effect, and your surgeon also wants a duration more than 1 hour, go for bupivacaine. If you have a patient you don't want a dense motor effect, and the duration also, if you would like to keep it a little lower side, of course, if you're going to use an equipotent dose, then you're going to get the same.
Out of the 4, the better advantageous situation using a neuraxial block for the ambulator patient, like one is faster recovery, better analgesia, use of opioid less, and cognitive dysfunction less, which is the most useful, and why? Out of the 4, which is, you have to choose only one, and you have to give me reason why this is the best.
See, if a patient is coming for an ambulatory anesthesia, definitely he would like to have all the above. So that is one answer, because he wants all of them. He will not be happy with just one choice. Okay. So definitely a patient is so much fearful about the pain. The perioperative period should be very comfortable for the patient. So I would choose my patient for a sensory effect. That is more important for me.
Had I been given this question, I would have said cognitive dysfunction. Cognitive dysfunction is never impaired after, very rarely. Of course, there have been instances of some impairment, even with spinal and epidural. But especially in elderly people, go for spinal or epidural. The cognitive, over general anesthesia, the cognitive dysfunction, POCD, is very less in post-operative patient and ambulatory patient.
Yeah.
Motilal sir,
I just want to say one thing, because if the patient is not going to get a good analgesia in the perioperative period, we would use a cocktail, and that cocktail would be rather more harmful in the post-operative period than anywhere else. So I'm very much against the cocktails, you know. So if you give anesthesia, give it properly.
Absolutely. Vanita Ahuja. Excellent.